Good evening, everyone. Myself, Dr. Rahul. Welcome back to Raaonline. Today, we'll discuss about the current technology or modern technology, that is low flow anesthesia. Low flow anesthesia are recently practiced in every OT. Mostly, we are also doing this low flow anesthesia because it has so much of advantage. It will lead to decrease in the OT theater pollutions. Also, there will be a greater conservations of anesthetic gases. Second thing is that low flow anesthesia requires strong monitoring, and different centers have their own limitations. They cannot practice low flow anesthesia. So going to the concept of low flow anesthesia, what is the definition? Any technique that uses the freskless flow that is less than the alveolar ventilation can be stated as a low flow anesthesia. It is an incisional anesthetic technique in which the rebreathing fraction of at least more than 50 amounts or 50%, where at least 50% of the exhaled gas mixture is retained to the patient after proper CO2 removal in the next inspiration. If more than 50% of the expired gas given to the patient after CO2 removal, it is known as low flow anesthesia. So coming to the Baker's modifications or definitions or Baker's modifications low flow anesthesia. So they are either metabolic flow, minimal flow, low flow, medium flow, high flow, very high flow. When we use more than 4 liters of fresh gas flow, that is known as very high flow anesthesia. High flow when we use 4 liters, medium flow when we use 2 liters, low flow either 1 liter or less than 1 liter, 0.5 minimal flow, and 0.25 is the metabolic flow. So these are the classifications of low flow anesthesia. So we can, in the exam also you can write what are the types of low flow anesthesia. Low flow anesthesia are 3 types: low flow, minimal flow, and metabolic flow. 1 liter, 1 to 0.5, and 0.5 to 2.5 or less than 2.5, less than 0.25 is metabolic flow. So when we use 2.5 ml of air, it is sufficient to meet the normal metabolic requirement of the body. So therefore it is known as metabolic flow anesthesia. And low flow around 1 liter. So low flow anesthesia, fresh gas flow less than 1 liter volume or less than the minute volume, recirculation of at least 50% of the exhaled air given to the patient, then it is low flow anesthesia. Coming to the theory, when we use high flow, it is 5 liter, intermediate is 2.5, low flow 1 liter, minimal flow 0.5, and the closed circuit ventilation, that is around 250 ml, 300 to 500 ml of air. So here we are main concerned about the rebreathing. Whenever we are using some amount of inhalational agent, it will go to the lungs, it will metabolize in the body, and it will go to the blood. But maximum fraction of the inhalational agent stays in the lung, it will exhale out in the next breath. It will again go to the circuit. It will also contain carbon dioxide. The carbon dioxide will be absorbed by the soda biker. The carbon dioxide will be absorbed by the soda lime, and the next breath we will return the patient with the maximum amount of expired gas contained inhalational agent. So the percentage of rebreathing will be 0% if we use 5 liter, because the CO2 or because the expired gas will not have sufficient time that it will be delivered to the patient. So there will be very less amount of rebreathing. When we use 2.5 liters, it is around 52% of the rebreathing gas can be delivered. So here we can see when we are doing a low flow, about 86% to 96% of the expired gases we can easily give to the patient. So therefore we use low flow anesthesia. Fresh gas flow is equal to minute volume plus rebreathing will be very much negligible. When we use fresh gas flow, comparing to our minute volume is around 5 liters. When we use fresh gas flow of around 5 liters per minute, rebreathing will be very much negligible or zero nearly. Coming to the different methods of low flow anesthesia, there are 2 types of circuit. We can achieve the low flow anesthesia through the closed circuit rebreathing system very easily. But it's very difficult to achieve the low flow anesthesia through the semi-closed, and it is impossible to achieve the low flow anesthesia in the open circuit because all the gases are removed or all the gases are delivered to the atmosphere. So here you can see semi-closed circuit, low flow anesthesia, fresh gas 1 liter per minute, minimal flow anesthesia or fresh gas flow around 500 ml per minute, closed system anesthesia, constant gas volume we have giving, and quantitative closed system anesthesia where constant volume and composition of anesthetic gases are delivered. This is the classification or methods of low flow anesthesia.